we're checking the chart here, and it looks like our next patient, we're going to be doing some wound care for a stage 3 pressure ulcer. What do you know of that, the etiology of that kind of wound?
Well, I know that the stage 3 is a full thickness tissue loss.
Mm-hmm.
I know that it can be caused from the pressure of the bone against the surface.
Mm-hmm.
I also know that it can limit blood flow and can be caused by shearing or friction.
That's absolutely true. So that's a really good summary of a stage 3 pressure ulcer. And what kind of complications can come from that kind of wound?
Well, I know that cellulitis can come from it. I know that bone and joint infections can also be caused by that. And some kinds of cancer and rarely sepsis.
Okay, that's very good. A great summary of it. And then in terms of how this kind of wound manifests, how do you see it manifesting? Any kinds of signs and symptoms that you'd like to know or pick up on?
Some signs to watch for. You're going to be watching for redness or any kind of burning that the patient is explaining. With a stage 3, it's going to be an open wound. It should have red edges. You have some pus and odor and heat from it, some drainage. You'll see some tissue, some fatty tissue, but you shouldn't be seeing any muscle or tendons or bones.
And what stage is when you're seeing muscle, tendons, and bones?
That would be a stage 4.
Absolutely. Okay. So, Mr. and Mrs. Buddock, my name is Nurse Sacral, and this is Student Nurse Ulcer, and we're here to help you with your bed sore, okay, and get you some treatment because you're being discharged today.
Can you tell me your name and date of birth?
Mr. Buddock, 12/28/81.
Great.
Wonderful. And so, when it comes to, since they're going to be going home, what over-the-counter options might they have in terms of treatment?
So some over-the-counter options that they can have as far as dressing or wound care, they can use antibiotics. They can use like a triple antibiotic ointment. They could also look into a pain relieving cream, something with lidocaine maybe in it to help relieve some of that pain. Ibuprofen is also a good option, and it's also got anti-inflammatory in it, so it can help with that. And just changing that position all the time is really helpful for keeping that wound from staying open.
Absolutely. And in terms of dressing, we're going to send them home with a hydrocolloidal dressing. But in terms of what they can receive over the counter, what can they do?
So I'm not sure if it's over the counter or not, but they have a calcium alginate dressing that they could use. They could also do a wet to dry dressing, which would have to be done every day, so I know it's not very convenient for you, Mrs. Buttocks, but it is more cost efficient. And they could also, the wet to dry is just more time consuming for you.
All right, Mr. Buttocks. Now, before you are discharged, we're going to assess your wound and take a peek at it and see where we're at, and so we can treat it properly. So we're going to do our hand hygiene.
Are you doing okay, Mr. Buttocks?
I'm feeling fantastic, except for this pain in my ass.
Are you doing okay, Mrs. Buttocks?
I'm great.
Are you feeling nauseous at all? Because this may be the point where you may need to.
Well,
assess
it
whether you're going to be
smells a
caring
little
for
bit,
it.
but I'm holding in there.
Okay. If
Not
at
my-
any
Some air
point you need a
freshener.
bucket, just let me know.
It's not my butt that smells. It's the wound.
Oh,
Just, just so you know.
okay. Are you sure?
No.
Oh.
Okay. All right. So, to determine our assessment here, what are we looking for first?
So you're going to be wanting to look at the wound type.
So that wound type, what I'm seeing is a full thickness. And that means that it's getting down to that fatty tissue, and you can see it's starting to crater a little bit, and there could even be some tunneling. Do you see that and note that?
I do see the tunneling and the, I do see that.
Absolutely. Now, in terms of location, this is in the sacral area, in terms of our assessment. And then also, it's really important when we're doing this wound care to measure it, to go through so we know and understand how that wound is progressing.
That tickles.
Sorry about the tickling.
How long have you had this wound, sir?
2 months.
2 months. So in terms of duration, that's a very good question. That's a part of our assessment as well. We need to know how long that it has been occurring. So we have the measurement, we have the location, we have the duration, and we know that it's a full thickness, that it is a stage 3 in order to
So I
determine
can
that.
document all of those as far as our documentation for this.
Absolutely. So I would document all of those results to make sure that it's well cared for. In addition to that, it's really important that we do a full physical assessment as well and include that into our documentation.
Okay.
Okay, Mr. Buttocks, we're now going to be treating your wound here. And the first thing, thank you, student nurse Ulcer. If you could get that enzyme cream, and what do we use this enzyme cream for?
We use the enzyme cream to debride and just get rid of some of that necrotic tissue.
Oh, I'm sorry, does that hurt?
No, it just tickled.
Just tickles, okay. Wonderful, so the next portion, we're gonna help with your drainage so your wound heals faster. So we're just gonna go through and place this ribbon into the wound, just loosely packing it. And if you would cut that
get
for me.
into the tunneling,
Yes.
because stage 3 ulcers do have that tunneling.
Very good, Nurse Ulcer.
I'm just going to cut here.
Wonderful, and we're gonna leave that little tail coming out to help with the drainage, right there.
And Miss Buttocks, this is where your part will come in at home.
Okay. Okay.
So we would want to put the gauze over, correct?
Absolutely. So
So you're telling me my wife has to pack my ass?
that's right. That's right. She's very good at managing
Nice
this,
of you.
though. I can tell already she'll be very good at it.
It'll be a spiritual experience for our relationship.
Okay.
And we would want to put the date and time and our initials on that dressing as well, correct?
Absolutely. So we know when that last dressing was changed, so it matches everything in the chart as well.
Great.
All right, Mr. and Mrs. Buttocks. Now I'm going to be helping you through and kind of teaching you how to go through and do this kind of wound care at home, okay? So with this kind of sacral pressure ulcer that's in a stage 3, what you want to do is you want to rotate positions when you are lying down at least every 2 hours. And if you're sitting down, you're doing that rotation every 15 minutes. And then in addition to that, for those dressing changes, if you're doing that gauze dressing, you have to do that every day. So when we have to keep that area nice and clean. Now for the hydrocolloidal, if the colloidal, that's done every 5 to 7 days, but it's a little more expensive, so it depends on what you prefer. And then we're going to continue to treat with Neosporin or a triple antibiotic ointment. And then if you have that kind of pain, we can also add in a little of that lidocaine or pain relieving cream into the wound, along the wound area. You can also take an ibuprofen to decrease that pain too. And then just as a good reminder, stay really well hydrated. So drink lots and lots of water, and make sure that your diet is good as well. And your overall goal for this wound is to get closure. Closure is always good, right?
So no more pizza.
I'm just gonna go ahead and cover you up now, okay?
Thanks.
You're welcome.
Do you have any questions, and can you repeat back to me what you'll be doing at home?
It sounds like I need to get some ibuprofen,
Mm-hmm.
some triple antibiotic ointment,
Mm-hmm.
or my wife does,
Mm-hmm.
and possibly get a cream for pain,
Yes.
and
Mhm.
keep hydrated and not eat as much pizza.
Yes, and Mrs. Buttocks, you'll probably be able to help him with that, keeping that diet, just making sure he's well hydrated.
Oh yeah, rabbit food
Mm-hmm.
from here on out.
That's right. And what about in terms of him changing position? How will you assist him in that?
Making sure he's getting up off his butt every 15 minutes to 2 hours.
Yes.
Very
That's good
important.
advice,
Yeah.
right?
That is very good advice.
Mhm. Absolutely. And if he's sitting down, you know, are you going to be changing? How often are you going to be changing positions if he's sitting?
Every 15 minutes?
Yes, absolutely. So right. All right. And in terms of any treatments to that wound with gauze, going over that procedure, you understand exactly how to go about it, so you can treat his wound.
You said that I would be using the little gauze pads with the
Mhm.
covering over it.
That's
correct?
right.
Mhm.
Mhm.
Okay.
And just keep it clean.
And we have you some handouts here too to help you with your
Oh, great.
dressing changes. Just a helpful reminder to help you know what all you need to be doing.
Can I get this stuff at like Walmart or the pharmacy?
Mm-hmm.
Would they have that?
Yep. And then your instructions for care as well are in there,
Okay.
and how to kind of help prevent his pressure ulcers from re-rising after we get this one healed.
Okay. All right.
Thank you.
So student nurse ulcer, do you feel like you have a good grasp as to what a stage 3 ulcer really is?
I do, but after all the education that we provided there, I know I've been studying really, really hard for midterms. I've been
Yes.
sitting a lot on my bum. I was just wondering if you could look at this and tell me what stage it is.